I wondered if you think it's appropriate in our federal system, you've also spoken about states' rights, that the federal government now take up national tort reform, or should that be better left to the states? Is it appropriate for the federal government for the first time to take up tort liability reform?
We do have some tort reform in Tennessee with mixed results. When I look at the tort reform proposals, I look at Alabama that badly needs tort reform, and then look at Tennessee that didn't need tort reform. Going to the SVMIC conferences each year, it seems like we didn't have outrageous awards for non-economic damages, so we had some tort reform that probably doesn't have a great deal of impact on the medical community. What I would like to see is an admission that we do make mistakes and we do have bad outcomes, and we want to be in a situation of continuous quality improvement so that we can admit when there are mistakes instead of dodging the problem, and remove physicians who need to be removed from practice if they're, under the influence of a drug or whatever. So to talk about tort reform as though there is no place for a patient to say, I have been wronged, is not a desirable end. I would like to see us have panels that would help negotiate when there's a bad outcome, look at the merit of a situation, and I would also like to see contingency fees from the lawyers capped and regulated, much like our fees are regulated for taking care of patients, and would also like to see a payment to patients over time so that there's not a lump sum payment that then is fraudulently gotten from them.
And Congress should adopt that.
No, I think the states can do that, but the Congress can help with guidelines.